Hello guys and welcome back to Code Sparkle. So today we're going to be discussing celiac disease. This video is intended for educational purposes only and is not to be used as a form of medical advice. So this video and all of the videos on the channel are intended for nursing students, nurses, and all other clinicians that find the information helpful and applicable to their practice. If you are a layperson that feels that you have any of the signs and symptoms, please speak to a medical professional directly. A medical professional includes a licensed physician, a licensed advanced practice registered nurse, and a licensed physician assistant. Again, also, I do strive for 100% accuracy, but if there's anything that you feel needs to be updated or other research shows differently, please put that in the comments below and I will do my own research and make any corrections that need to be made. Okay, so let's get to the fun part. So, celiac disease is an autoimmune disease, and a lot of times we forget about autoimmune diseases, but a big one that we forget is an autoimmune disease is type 1 diabetes. And interestingly enough, having an autoimmune disease can be a risk factor for celiac disease. So, what are some autoimmune diseases you can think of right off the bat? Lupus and type 1 diabetes, right? I feel like type 1 diabetes is one that we, especially as clinicians, forget a lot. We might see it when we're studying once in passing, but we don't really harp on it. But it definitely is an autoimmune disease. So, what is an autoimmune disease? Whenever there's an autoimmune disease, there's inflammation, right? Specifically with celiac disease, there is damage to the small intestinal mucosa, specifically the duodenum. And what is the function of the small intestine? The function of the small intestine is digestion and absorption. And the small intestine is where majority of the digestion of proteins, carbs, fats, and a lot of important nutrients happens. So with celiac disease, the damage occurs when the person consumes gluten. Gluten is basically triggers an inflammatory reaction in the person's small intestine, which makes it difficult for them to absorb nutrients. Specifically, what happens is that there is tissue destruction, right? They consume gluten, there's tissue destruction. Well, first of all, they consume gluten, there's inflammation, tissue destruction, and then ultimately tissue death. Specifically, the tissue basically atrophy. More specifically, the villi in the small intestine become atrophied. So let's say you eat a lot of gluten, your villi are atrophied, but let's say you go eat something else that isn't gluten based, like eggs, and you can't even absorb the nutrients in the eggs because you have, decayed villi. So this is a ailment of absorption and digestion. So you should expect people with celiac disease maybe to present with a lot of, malnutrition or, maybe digestive issues like diarrhea or flatulence. That's something to keep in mind. So essentially, there's inflammation, tissue destruction, and then atrophy. And a risk factor for celiac disease, like I said earlier, is other autoimmune diseases like type 1 diabetes. Specifically, though, there is an allele that can sometimes be a risk factor for celiac disease. There are two alleles, allele HLA-DQ2 or HLA-DQ8. So there has been studies that have shown that people with this allele do have celiac disease, but then there's also some studies that show that people with this allele don't have celiac disease. So having this allele is not a definite determination that you will have celiac disease. So some people with this allele have celiac disease, and some people with this allele do not have the celiac disease. But gluten does break down into a protein called proalamine, and proalamine and these alleles, when they combine, they create an inflammatory reaction in the body and in the stomach. So this is what creates that inflammation, um, tissue destruction, and then atrophy. And specifically, we should remember the villi of the small intestine. So, what are some signs and symptoms? Or first, let's rediscuss the risk factors. So, other autoimmune diseases like type 1 diabetes. What are some other autoimmune diseases? Lupus, Sjögren's syndrome. There's multiple types of autoimmune diseases, but usually um, those are common risk factors. Let's talk about the clinical manifestations of celiac disease. So, flatulence, right? Gassiness. If something's not sitting well in your stomach, you might be gassy. Diarrhea. A lot of times, foul smelling diarrhea. Why is it foul? Because it's not digesting well. Anemia, because of lack of ability to have to digest iron. That would be shown through a lab result though, or just weakness. A lot of times maybe hair thinning, hair loss from a protein deficiency, weight loss, obviously, muscle weakness. Peripheral neuropathy might be from a cobalamin deficiency. And then osteoporosis because of the lack of ability to absorb vitamin D or calcium. And then sometimes they might not have any signs and symptoms. They might have atypical signs and symptoms. They might not present with specifically gastrointestinal signs and symptoms like maybe diarrhea or flatulence or something like that. As a nurse, what should you look for? Besides these clinical manifestations, also their labs. Their iron levels might be altered, cobalamin levels, folate levels, calcium levels, and vitamin D levels. So then the main treatment for this, the gold standard is to do a biopsy through an endoscopy. And usually that biopsy might show the mucosa as mosaic looking. If you think of like a mosaic, it's going to present like that in the pictures from the biopsy and the pathology pictures. And then treatment is usually more diet based. So they will definitely have to consult with a nutritionist or a dietitian on what foods to avoid. Those are the main things. This is a more diet based treatment. So as a nurse, let's go through the nursing process. So our assessment, what would we find? We would find someone that's probably weak. If this is prolonged, maybe a peripheral neuropathy from cobalamin deficiency, they're probably going to have flatulence, abdominal distension, foul smelling diarrhea, maybe weak bones. We might see other things like hair loss, hair thinning if this has gone on for very long and they weren't aware, they haven't addressed it with the physician yet. And then diagnosis. So if you see this kind of impaired, there's an impaired function to digest, right? So what are some NANDA diagnoses we can put for this patient? We can put imbalanced nutrition. Risk for falls is a big one, right? So that's the diagnosis. So what should the plan be? That's the next part in the nursing process, right? In our ADPI. So the plan should be make sure the doctor has put in an order for a nutritional or dietary consult. And then also make sure that, if they're in the hospital or this is an outpatient setting, making sure that they're aware of the foods to avoid that do, basically that do have gluten. And then making sure there's safety measures, making sure if they're making frequent trips to the bathroom, making sure that they have support to do that. There's no fall hazards to do that if they're living at home. Making sure that they have proper means in case they maybe have sometimes they might have diarrhea that is, that they're not sure it just comes. So making sure that they have appropriate resources for that, making sure there's no fall hazards in the house because they are so weak. It might take a while for their, electrolyte levels to come back regulated, things like their iron and their calcium, and to that to really show an impact in like their bones and their health and their body. And then what is the implementation? So the implementation is making sure that they do meet with the nutritionists and that they know foods to avoid and foods that are okay to eat. Just some foods to avoid in celiac disease: baked goods like muffins, cookies, cakes, pies, barley bread, including wheat bread, potato bread, gluten stabilizers, oats, no oatmeal, pizza, bagels, rye and wheat foods they can eat, yogurt, soy products, potatoes, meat, fish, not marinated or breaded fish, gluten-free breads, crackers, fresh fruits. There's a lot. Corn tortillas, those are foods they can't eat. Other parts of the implementation: safety measures, like I said again, if they're making frequent trips to the bathroom, making sure that they have a safe trip there, a safe means of getting there. Also, skincare, they're elderly and they're having diarrhea, making sure that there's no impaired skin integrity, that the skin is still intact, and there's no irritation from the diarrhea. And also evaluating it, later on, making sure that their levels of iron, folate, calcium do come back up. They do report better strength. They are adhering to the food, foods to avoid and foods to eat. Maybe they have a food diary. Those are things you would do in your evaluation. So that is celiac disease according to the nursing process. Thank you guys for watching and happy learning.